Or you wouldn't happen to.
Oh my gosh. We're missing the nose. Marital madness, tattered tootsies, and whatever you do, don't trust smelly doctors. Today we're breaking down and reacting to all of the post-apocalyptic medical scenes and disastrous injuries from the highly anticipated TV series Fallout. Let's dive right in. Oh, punch to the groin.
My groin!
I don't know if any of you have ever gotten punched in the groin before, but it hurts and you get really bad abdominal pain. It's because your testicles were actually inside your abdomen while you were being made, and they actually descended to be outside of our body. Nothing like a slice to the forearm. I don't know if any of you noticed your back of your forearm, there actually is a big vein that sits back there. You can have a superficial cut to your forearm that lacerates a big major vessel there. Oh, where'd the blade go? Oh man, right in the abdomen. It looks like left lower side, could be mid. If it's on the left side, things that you worry about, your spleen, you worry about your kidney in the back, and then intestines all the way down. Oh. Oh. Broken glass. I've actually seen individuals that have had massive lacerations due to broken glass. This gentleman just got stabbed right into the lateral aspect of the neck. What major vessels are there? Jugular vein and your carotid artery. Oh, yeah, no. What do I tell everybody out there? Don't pull that out. Now you increase the risk of any major vessel bleeding as well as poop getting into the abdomen. All right, we got a sweet first aid kit. Everybody should have a first aid kit at their home. We got tape, we got ace wraps, we got some meds. We have a very rusty old syringe. Okay, so we're stabbing meds right into the abdomen, right to the wound. We do this, say, with like rabies. Instead of just using the vaccine for rabies, we actually use immunoglobulin, and you're actually instructed to inject a lot of it around the wounds. Oh, wow. She's pinching the skin together, which is good. Obviously, your hands are dirty, and this is a dirty wound, so it needs to have some sort of antibiotic therapy. This does appear to be very similar to the staple guns that we use. We use disposable staple guns. This looks like one that's non-disposable.
Or you wouldn't happen to.
Oh my gosh. We're missing the nose. So the nose aspect here, it's all cartilage right there, right? There's no bone. There's bone up on your bridge and then down on the angle the exact way that we see here.
But I've been paid a whole lot of caps to provide this man safe transport out of Philly.
Oh man. Good job from a graphic standpoint of how it looks. We have a complete amputation of the lower extremity below the knee, mid tib fib, and you're seeing kind of just ripped tissue. That is normally what happens, and it's actually dripping blood pretty good. So what would you do in that circumstance? Probably want to put a tourniquet, proximal, obviously. Could you reattach that if you had the other piece? You're probably missing a big section, so probably unlikely, and it's not a clean sliced wound like a nice piece of ham. Oh my gosh. Oh man. Did a good job of showing like what tissue looks like, what flesh looks like. Typically what we'd end up doing, wound dressings, cover that end. We'll probably use a wet dressing. Oh, what is this? What? Come on, what the heck was that? It looks like either a cigarette cutter or some sort of like rock cutting device.
If you think this little thing can haul your limping across the wasteland, you may not be as smart as people say you are.
You have anyone else you can trust in this town?
I was thinking that that device was almost to like cut and clean off the edge so then you can put a prosthesis on it. But no, that just like ate into the tissue to bind to it to then put on a foot on the bottom. Is walking on it, come on.
Come on!
Would you be able to walk on it? Well, probably if the most of the pressure was above on the healthy tissue closer to the knee, that's gonna still be extremely painful. Oi, oh. Jaw fracture, intracranial bleed, and even with that amount of torque to the head, you increase the risk of cervical fractures. Oh no! Oh That looked like a very ripe pomegranate getting exploded open. Oh my gosh. When I've seen trauma to somebody's head, there's not that much fluid. You see on the ground bits of brain matter. You have gray and white matter of your brain. Kind of looks more like a pale, kind of grayish brown kind of color. Holy cow!
I'm gonna die.
How is he not in excruciating pain? That bone looks like it's in pieces. That is the metatarsal on top, and all that blood and tissue exposed increase the risk of infection.
I've seen this condition before. Someone stepped on my foot. Yes, sometimes fatal. But you're in luck.
So it's like the doc. He's like, I've seen this before. Yeah, somebody just like crushed my foot. Yeah, I hope you've seen that before. Yeah, I don't know if I'd want medicine that's like stored in these kind of vials.
This elixir I have concocted heals all.
It just makes me think about all the products out there on the internet. That's why I came up with my company called Life Happens, and here's an example of one of the products. This is an Amazon show. We're on Amazon as well, and you can get this via Prime. So that could have been something that he inhaled versus swallowed. Holy cow, you're seeing it come together. How cool is that? I don't think there's anything we have in modern medicine that makes that happen.
Okay,
Oh! Arrow straight through his neck. Depending on where it actually goes, you could actually survive this. If it goes between like your airway and your spine, missing all major structures, it's now just in the soft tissue. Now you just have the problem of trying to get this out.
why am I not dead?
I wouldn't do that.
Well, I'm not just gonna leave it there.
Certain circumstances, you might want to make it smaller, but still leave it in place. You can do that. Oh, so the tip of the arrow does not have a barb on it that would prevent it from going back. Oh, but he is healing up.
That is... I think you might be a ghoul.
Oh, no. So stupid. I should have never trusted a doctor that smelled like that.
You need to trust your doctor. Having a conversation with doctors, knowing exactly what you're getting is really important, and have a doctor explain it. It's okay. I explain to my patients all the time what's happening, what we think's going on, what's the plan, what are the medicines that we're going to be using, and then what are the next steps. Fallout, I love the video game, and I am really into the fact that it was made into a TV show, and I think they did a really good job. Have you guys been watching this? I've seen a few episodes. I think it's quite entertaining, a little quirky. As always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. And thank you so much for watching. Stay healthy, my friends.